All right, let's talk about something that for a lot of guys might not even be on their radar: breast nodules. Yeah, you heard that right. It's a topic that's pretty easy to overlook, but, being in the know is a huge part of staying on top of your health. So let's just cut to the chase. A lump in a man's chest? What's that about? Is that even a thing? Well, the short answer is yes, absolutely. And if this is something you've experienced, trust me, you are definitely not alone. Actually, it's way more common than you probably guess. Here's the deal. Men have breast tissue. It's just a lot less of it than women have. And since that tissue is there, well, it can form lumps or nodules, just like any other part of the body. Okay, so we've established that this is a real thing. Let's dig into the basics then. What exactly are we talking about here, and where would you even find one? So, for guys, most of that breast tissue is right behind the nipple and the areola. And, surprise, surprise, that's usually where you'll find a nodule. The number one most common spot? Right under the nipple. You might also feel something around the areola or a bit to the side. Oh, and it's always a good idea to check near your armpit too, since a lump there could be a swollen lymph node. All right, this next part is super important, so listen up. Finding a lump can be, pretty scary, but I want to be really clear. The vast majority of the time, it's nothing to panic about. So let's talk about the most common and totally harmless causes. So the top reason by a long shot is something called gynecomastia. Big word, simple idea. It's just enlarged male breast tissue. It's incredibly common, and it usually feels like a firm, kind of disc-shaped lump right under the nipple. It might even be a little sore. And what causes it? Usually, it's just your hormones doing their thing. So what kicks off these hormonal changes? Well, it can be totally normal stuff, like going through puberty. But other things can trigger it too, like obesity, other hormonal imbalances, or even some medications. You see? It's often tied to really common things your body can go through. Okay, let's compare the two most common benign lumps. On one side, you've got gynecomastia, that firm, disc-like thing we just talked about. And on the other, you have something called a lipoma. A lipoma is basically just a harmless little ball of fat cells. The key difference is the feel. A lipoma is usually soft, kind of rubbery, and you can wiggle it around under your skin pretty easily. All right, so we've covered the common stuff, the stuff that's usually nothing to worry about. Now we've got to switch gears for a minute and talk about the rare cases, the signs that a nodule might be something more serious. This is need-to-know information for every guy out there. But look, before we get into the warning signs, let's put things in perspective. Male breast cancer is really rare. We're talking about only 1% of all breast cancer cases. So yeah, it's super important to be aware, but it's also important to remember the odds are very, very low. Okay, so what are the red flags? What's the stuff you really need to look out for? Here we go. A lump that feels super hard, maybe has a weird, irregular shape. Or if it feels like it's stuck, like you can't move it. That's a big one. Another thing is any change to the nipple, if it starts to pull inward, or if there's any discharge or bleeding. And finally, a new lump or swelling in your armpit. Any of those things mean it's time to see a doctor. Knowing what to look for is huge, but you know what's even better? Being proactive. So let's actually walk through a really simple check you can do yourself to stay on top of any changes. It's super easy, just 4 steps. Step 1, just use your fingertips and gently press around your nipple and the areola. Step 2, as you're doing that, feel for any small, hard lumps or knots under the skin. Step 3, compare your left side and your right side. Do they feel pretty much the same? They should. And last but not least, step 4, gently feel around in your armpit for any lumps there too. Whew, okay, we've gone through a lot, so let's just boil it all down to the key takeaways. What do you really need to remember from all this, and what should you do next? Think of this as your action plan. So when do you actually need to call a doctor? Well, if you have a nodule that sticks around for more than, say, 2 to 4 weeks, or if you feel a lump that's definitely getting bigger, if the area starts to get really painful, or if you see any of those nipple changes we mentioned, like discharge or retraction, and of course, if you find a new lump in your armpit. Any of those things are a green light to get it checked out. Look, if you take away just one single thing today, please let it be this. Most of these nodules are completely harmless, but, and this is a big but, any new lump or any lump that's changing always needs to be checked by a doctor. Period. Don't guess. Just get it checked.
At the end of the day, just being aware of your own body is the biggest first step you can take for your health. So now you know what to look for. The only question left is, what's your next step?